You know that feeling, right? That little sniffle starts, maybe a bit of a cough, and you just think, oh, it's just a common cold. But what if that really common illness has a far more serious side, even, life-threatening sometimes? Today, we're not just scratching the surface of respiratory syncytial virus, or RSV. No, we're taking a proper deep dive into its hidden dangers, especially for the most vulnerable among us. Our mission here is to cut through the noise, to give you a concise but, really comprehensive understanding of RSV. So what it is, how it spreads, who's truly most at risk, and crucially, how you can protect yourself and your loved ones. We're here to pull out the most important bits of knowledge for you.
Yeah, and what's really fascinating here, I think, is how often something so common can be so, well, so misunderstood, especially when you look at its impacts, on its devastating impact on different age groups. We'll try and connect those dots for you today.
Okay, let's unpack this then, because as you say, it's so common. Many of us have heard of RSV, maybe in relation to babies, perhaps, but there seems to be a lot more to it than meets the eye.
There really is.
Yeah.
And that commonality, that's part of the problem sometimes.
Right, because we just shrug it off. So for anyone listening who maybe hasn't thought much about RSV beyond a bad cold, what exactly is this virus? How does it get confused so easily?
Okay, so essentially, RSV is a virus. It causes respiratory infection, simple as that. But its symptoms, they're clever. They really mimic a typical cold. And here's the kicker.
Yeah.
It's incredibly common. Almost every child, we're talking up to 9 in 10, will actually get RSV before they even turn 2.
9 in 10, wow.
Yeah. And most of us will get it at some point, probably multiple times, and not even realize that's what it was.
So that's the trap, isn't it? We dismiss it.
Exactly. We think, oh, it's just another cold. We completely underestimate its potential, its sort of insidious ability to become really serious, even life-threatening, especially when you think about how easily we can pass it on, maybe unknowingly, to people who are much more vulnerable, like tiny babies or older people. So this isn't just about a sniffle. It's a really widespread virus that, for certain groups, is a silent, quite serious threat.
That really reframes the whole common cold thing. Okay, so how does something so, ubiquitous manage to spread quite so effectively?
Well, it's incredibly efficient at spreading. Primarily, it's through airborne particles. So think about it. Someone coughs or they sneeze.
Right.
Those tiny droplets from their respiratory tract, they hang in the air. Someone else breathes them in. Or they land on surfaces.
Ah, okay, so you touch a doorknob, then rub your eye.
Precisely. You touch that contaminated surface, then your face, eyes, nose, mouth, and bingo, the virus has found a way in. Direct entry point.
So it's not just breathing it in, it's contact, too, surfaces.
Both. Droplets spread in contact with contaminated surfaces.
And while RSV can, you said, pop up anytime, our sources show it really ramps up during certain periods, doesn't it?
Oh, absolutely. While it technically circulates all year round, it definitely has a peak season, usually the colder months.
Like flu season.
Pretty much. Think October through to February, with December and January often being the highest risk months. That's when we see the biggest surges.
Okay. Now, when someone does get RSV, what are the specific symptoms we should be looking out for beyond that initial sort of cold-like feeling?
Well, the initial symptoms, they do trick you. They look just like a regular cold. Runny or blocked nose, sneezing, maybe a cough, feeling tired, perhaps a fever.
Standard stuff.
Yeah, pretty standard. You might also notice some wheezing or maybe feeling a bit breathless. For the vast majority of people, these symptoms usually clear up on their own, say within 7 to 10 days.
There's always a but.
But, and this is where we need to be really vigilant, RSV can sometimes escalate. It can lead to more severe complications.
Okay, what kind of complications are we talking about? And who is really at the sharp end of that risk? Who needs to be most careful?
So the main concerns are things like pneumonia, which is a nasty infection deep in the lungs, and also bronchiolitis. That's an inflammation of the tiny airways in the lungs, particularly a problem for little ones.
Right.
Now, who's at highest risk? Well, top of the list are babies and very young children, especially those under 2. Then you've got older adults, particularly those over 75. Also, people with weakened immune systems, perhaps due to illness or treatments, and anyone with chronic lung or heart disease. Oh, and smokers, too. They're also at higher risk of complications.
That list, it's quite sobering, isn't it? It really makes you rethink dismissing symptoms.
Yeah.
So what are the immediate red flags, the signs that tell us, okay, this isn't just a cold, it's time to get medical help?
Absolutely. You need to know when to act. The critical symptoms to watch for are things like a cough that's getting noticeably worse, or significant difficulty breathing, really struggling for breath.
Oh.
Noisy breathing, like wheezing or grunting sounds. For babies, and this is really important, look for long pauses between breaths. Or if they're not feeding well, seem really lethargic.
And for older adults?
For older adults, watch out for a loss of appetite or any signs of confusion or unusual drowsiness. Those are clear signals that you need to seek medical advice, without delay.
Right. Don't wait. But for those less severe cases, the ones that stay like a bad cold, how should people manage RSV at home?
Yeah, for most people, it will just be like a bad cold or flu. And in those cases, it generally improves on its own within, say, 1 to 2 weeks. So at-home care is pretty straightforward, really. Focus on staying well hydrated, plenty of fluids, get lots of rest, and you can use things like paracetamol or ibuprofen to help with fever or aches and pains if needed.
Standard cold and flu care, basically.
Pretty much. But the key thing truly is to keep a close eye on those symptoms. Monitor them. And if you're ever worried or if things seem to be getting worse instead of better, don't hesitate. Reach out for medical advice. Better safe than sorry.
Definitely. Now, shifting gears slightly, something that really jumped out at me from our sources was the kind of hidden danger of RSV for seniors. We often think of it as a kid's illness, right?
Well, you do.
But the data on older adults is, frankly, quite shocking. Can you walk us through the scale of this problem? It seems really underestimated.
It really is. It's an often overlooked public health challenge. And the statistics, they are stark. Just looking at the U.S., for instance, each year, somewhere between 60,000 and 160,000 older Americans end up hospitalized because of RSV.
Wow, hospitalized.
Yeah. And tragically, about 6,000 to 10,000 actually die from it each year in the U.S. alone.
That's staggering.
It is. And it's not just a U.S. issue. Looking at the U.K., for example, around 175,000 people over 65 visit their GP because of RSV symptoms every year. So this completely blows apart that idea that it's just a childhood nuisance. It's a serious threat to older people, too.
It absolutely broadens the picture.
Yeah.
What specific factors make seniors particularly susceptible to these really severe outcomes?
Well, age itself is a big one. Specifically being 60 and older seems to be the general threshold where risk increases. But beyond just age, other risk factors pile on. Things like living in long-term care facilities, like nursing homes.
Okay.
Having underlying chronic illnesses, we're talking diabetes, heart disease, kidney or liver problems, lung conditions like COPD or asthma, and, again, having a weakened or compromised immune system. All these things significantly increase the likelihood of RSV turning nasty in older adults.
Right. But the good news, I suppose, is that science is fighting back on this front. We actually have vaccinations available now specifically for seniors, don't we?
Yes, that's been a huge step forward recently, a really significant advancement. The CDC in the U.S. now recommends that adults aged 60 and over have a chat with their doctor about getting vaccinated against RSV.
Okay.
And there are currently 2 FDA-approved vaccines available. One's called RSV, that's from GSK, and the other is Abrysvo from Pfizer.
And are they effective? What does the research show?
They seem to be pretty good, yeah. Both have shown impressive effectiveness in trials. We're talking around 83 to 89% effective in preventing RSV-related lung infections, like pneumonia, during that first RSV season after vaccination.
That's quite high.
It is. And looking overall, research suggests the vaccine is about 82% effective in preventing actual hospitalizations in older people due to RSV. So it makes a real difference.
How does it work? Is it multiple shots?
Right now, it's just a single dose that's recommended. And the side effects are generally what you'd expect from a vaccine, usually mild. Things like a sore arm at the injection site, maybe a headache, a bit of a fever, or a feeling tired for a day or so.
Okay. And for our listeners maybe in the U.S., what's the situation regarding cost or coverage for this vaccine? Is it accessible?
That's a good question. For folks in the U.S. with Medicare, specifically Medicare Part D, it typically covers the vaccine, usually at no cost, provided you get it from a provider who's in your network.
That's good to know. Makes it accessible.
Exactly. And it highlights a broader trend we're seeing, in healthcare systems globally, really pushing towards preventive measures like vaccination, making them more accessible and prioritized.
That's a vital piece of the puzzle for protecting seniors. Now let's pivot back to the other end of the age spectrum, newborns. They're also incredibly vulnerable, as we mentioned. And our sources hinted at a really interesting, kind of innovative way to protect them right from the start.
Yes, absolutely. And if we connect this to the bigger picture, it's not just older adults who need this proactive protection. Health experts, particularly from NHS England, are now urgently recommending that eligible pregnant women also get vaccinated against RSV, usually later in pregnancy.
Pregnant women getting the RSV vaccine? Why?
It sounds counterintuitive at first, maybe, but the reason is actually quite brilliant. It's to protect their newborns, right from the moment they're born.
How does that work?
It's through something called passive immunity. The mother gets the vaccine, her body produces antibodies, and these antibodies are passed across the placenta to the baby before birth.
Ah, so the baby is born with some protection already.
Exactly. Protection that lasts for the first few crucial months of life when they are most vulnerable to severe RSV.
That's clever. And is there a particular urgency around this now?
Well, yes, there's some interesting context here. If we
What?
look internationally, last year, Australia apparently saw its highest ever number of RSV cases during their winter.
Okay.
And health officials, like those at the NHS, often look at Australia's winter patterns as a potential predictor for how viruses might spread in the Northern Hemisphere's winter, like in England.
So Australia's bad season could mean a bad season is coming for the UK.
It's a potential warning sign, yes.
Okay.
And they're already observing RSV cases rising steadily, actually since early 2025 in this scenario, with nearly half of the reported cases being in children under 5. So the timing is critical.
That global connection is really insightful. What's the direct message from health officials, like midwives, about this pregnancy vaccination?
Well, Kate Brentworth, who's the Chief Midwifery Officer for NHS England, put it very clearly. She said, and I'm quoting roughly here, "Getting vaccinated while pregnant is the best way to protect your baby from the moment they're born."
Right.
She stressed, now is the time for mums to act, to make sure their babies are protected ahead of their first few months this winter when more bugs tend to circulate.
So when in pregnancy is it recommended?
The current recommendation is generally for pregnant women from 28 weeks gestation onwards. Gives enough time for those antibodies to develop and pass to the baby.
Okay, so we have targeted vaccination for seniors and this approach for newborns via pregnant women. What about the rest of us? What are the universal prevention strategies that apply to everyone every year?
Good point. Beyond vaccines, there are those fundamental but incredibly effective steps everyone can take. It really boils down to good hygiene.
The basics, but they work.
You really do. So consistently using tissues when you cough or sneeze. And this is key, disposing of them properly straight away, not leaving used tissues lying around.
Got it. And hand washing.
Absolutely crucial. Washing your hands frequently and thoroughly with soap and water, or using alcohol-based hand sanitizer if soap and water aren't available, and regularly disinfecting commonly touched surfaces, doorknobs, phones, keyboards.
Right, those high traffic areas.
Yeah.
And then there's avoiding contact.
Yes. Minimizing the spread. So always cover your sneezes and coughs into a tissue or your elbow, not your hands. Try to avoid touching your face, especially your eyes, nose, and mouth, before washing your hands. And obviously, try to avoid close contact with people who are clearly sick. If someone's coughing and sneezing, keep a bit of distance if you can.
And flipping that, if you're the one who's unwell.
Then the best thing you can do for everyone else is to stay home. Don't go to work or school or social events if you're feeling ill, especially with respiratory symptoms. Reduce the chance of spreading it.
Makes sense. And just a final reminder on vaccines overall.
Just a general point, if you fall into one of those eligible groups we talked about, older adults, pregnant women, and you think you should get the vaccine but haven't been contacted, don't just wait. Be proactive. Reach out to your GP or your healthcare provider and ask about it.
Good advice. Okay, so let's try and wrap this up. We've covered a lot of ground. What's the main takeaway here? What does this all mean for us? RSV, it seems, is incredibly common. Often it just looks like a simple cold. But as we've seen pretty clearly from the data and the advice, it can be unexpectedly and sometimes seriously dangerous, particularly for the very young, the very old, and people with underlying health issues.
Exactly. And I think this really raises an important question, doesn't it? Given just how widespread RSV is and its potential for causing severe illness and even death, are we, as a society, sufficiently aware of it? Do we really treat it as the significant public health concern it clearly is? Or is it still too often just dismissed as part of the usual cold and flu season?
That's a really thought-provoking point. It makes you consider the broader implications, doesn't it? These seasonal viruses, how interconnected global health patterns can be, like that Australia predicting England's season example. It's definitely a powerful reminder, I think, for all of us to think about how proactive measures, everything from simple hand washing right up to these new vaccination strategies, can genuinely safeguard our communities. Protecting everyone against these common, yes, but potentially really severe threats like RSV is something to definitely keep in mind.